That's like a really lovely part about John Dolan is that we have some students that it, to the naked eye, appears that this student is sleeping in their wheelchair all day. But the tone and everything that everyone does for the student all day is you still speak to them and you speak through them, if that makes sense. So I think an older school way of maybe working with this type of student would be to talk over them or to just talk to the other adult that's providing care and just exchanging information over them. But one thing that I'm just so proud of at our school is the way that students, even if they appear to be sleeping, even if they appear not to be interested at all, are involved in the conversation. So for example, little Greg is in his wheelchair. It's time for the nurse to come check his oxygen because it's almost lunchtime. We're going to hook him up to his G-tube. We always just say, it's like, oh, Greg, it looks like the nurse is coming down the hall. All right, Greg, you don't mind if I quickly take your oxygen, do you? And like any information that you're delivering about the student could be to the student, if that makes sense. Even if they're not able to be like, yep, sounds good. But like that's, I guess a tip I would use too. So like for anybody.
Yeah, and it's always addressing them.
Yes. Yeah. And then once you're talking more about procedural things with either their caregivers, if they're in the room too, or to this individual, and you're not sure how much information they're able to actually receive and take on, I would just say removing filler words is also really useful.